wanted to thank you all for joining today's panel. As you see, we have a great panel of esteemed individuals that will be discussing amplifying the participant voice today. I wanted to introduce briefly each panelist, and we're going to just jump into questions right after I introduce them, because we want to be mindful of time and ensure that we can address all the questions that are presented to them. So first, we have Rochelle Long, who is GAP Citizen Scientist Cornerstone Award honoree. So happy to have you, Rochelle. And we have Dr. Debra Tann. She's the founder and chairwoman of the board for Reminiscent. So we're so happy to have you, Dr. Tann. And then we have Jenee Williams, who is Director of Patient Advocacy at Genentech. So we're just so excited to have all three of you on today's panel. So we're just going to start, if that's okay. I'm going to open it up with questions, and I'm going to start with you, Jenee, if that's okay. So my first question to you is, what does amplifying the participant voice mean to you? And why is it crucial for creating meaningful change?
So that's a really good question. I'm trying to make sure I'm off mute. That's always my hardest activity of the day. But amplifying the participant voice means so many things. But to keep it brief, I'll just focus on a few. To me, it's really taking an initial posture of listening and learning to understand perspectives that are different for those that are touched by neurological diseases. And I'm thinking both the person living with the disease and their care partner. It's pushing internal and external stakeholders to give patients and care partners a seat at the strategy setting tables to really help us shape key decisions and opportunities. And more importantly, I would say to Genentech, it means coming alongside organizations, advocates, and others, just those that are really entrenched in communities, to amplify their messages and to fight for policies that are hindering access and resources for those families that are impacted. So when I think of it kind of in its sum, amplifying the patient voice means a lot of things, but from a pharmaceutical standpoint, it's critical because without the insights of those for whom we are seeking to create medicines, we can ensure that those therapies will address the needs that matter most to people. And we can ensure that the medicines that we're developing will reach those who need it most. So I believe that there's really no way to develop trust in communities if they're not engaged. So that's really like our starting point.
That's great, Jenee. Thank you so much, because trust is so important, isn't it? I know we're going to probably hear that word multiple times throughout today, but no, thank you so much. And I thank you so much for providing your perspective from the pharma, right? While you work in pharma, because it's great to have, just differential perspectives, especially when we're talking about the participant voice and amplifying it. So thank you so much. Dr. Tann, I'm going to actually ask you the same question as well. What does amplifying the participant voice mean to you, and why is it crucial for creating meaningful change? Oh, I think you're on mute.
I have to follow my colleague and be on top of things, like Jenee said, unmute first. Thank you for having each and every one of us. I want to say, as we think about amplification, I just want to take the first three letters of the word amp. The younger generation that would not include me would say, turn it up. So let's turn it up and think about the word amplification. When I think about the A in amplification, I think about awareness. I think about accessibility. I think about acceptability, and I think about availability. When I think about the word M, I think about the mission. I don't believe the mission in this space should be driven totally by people that look like me and act like me and do not live with a disease. I think it should be driven by people living with dementia. And so that takes me to the P. So that's when I think I come into play, and people that are on this call and that are listening to us today, I think about people who come alongside individuals living with dementia to bring the mission and certainly the vision to pass. I think this is crucial. Let me tell you why. As we think about meaningful change, I pose this question. It's a simple one. How do we consider or think about invoking meaningful change if you don't involve the very people that you hope to change? So those are my quick answers to your question, Dr. MaGee Rodgers.
Lovely. Thank you so much, Dr. Tann. You're right. It's all about the people, right? The people that we serve. So thank you so much. I appreciate that. And same question, and I will repeat it for you. So I know we had some people who just joined. But what does amplifying the participant voice mean to you? And why is it crucial for creating meaningful change? And you can unmute. I'm sorry, Rochelle. Yeah, no problem. I know. It's a
Did
it's
the
a
same thing. I wanted it to be unified for the panel. I will have to tag on to partially to both Jenee and Dr. Tann, because I too looked up the definition. I wanted to see what all the difference were. And the one that I chose to tag on to says to enlarge upon or add detail. Research in a lab is science and biology. With those who are living with this disease, it's real, it's action, it's what happens and what you have to do. As a result, your day changes, your life changes. It has a different meaning when you are in the thick of it, when you see the person that it has an effect for. It's way different. From the farm side, I've always said what works on white males doesn't always work on Black women. You know, coming from the African American community, also, my mother has been diagnosed 17 and a half years with this disease. She lost 3 siblings and her mother, all to this disease. My father passed 2 years ago, and he went from 0 to 60 in just a matter of weeks. Unfortunately, he passed from a heart attack, not the disease. So I'm deeply entrenched into research, science, and actual advocacy for the caregiver, because the caregiver is on the front line with that individual living with this disease. And they see things that you can't see under the microscope. They experience it, they live through it. And so it adds a different layer. So when you're trying to accomplish something, if you're trying to bake a cake and you don't have that sugar, it's essential to the cake's outcome. So you need to add that sugar, and it becomes a critical part. And all of us need to be a part of research and science. I personally will talk to whoever listens to me. I've been in clinical trials and research for over 20 years as a participant, as a caregiver. Now I am a double 4, what they call a double 4, ApoE4. I got 1 gene from each parent. So my odds went up, but my work went the same way. My commitment is just as solid. I don't have time to worry about it. I'm trying to do as much as I can to anyone who will listen and who I can encourage.
Thank you so much, Rochelle, for sharing your story. Wow. I tell you, you are amazing and resilient. I would say that, especially of all the things and, tribulations you have encountered, but yet, hey, you still advocate, right? For research, right? For representation and research. So we appreciate that. Thank you so much. Yeah, thank you. Okay, I have a next question. So Jenee, what are the key challenges organizations or movements face when trying to elevate the voices of those directly impacted by a neurodegenerative disease? Like, for instance, Parkinson's, I guess I would say.
You know why I'm chuckling for that question, but yes. So I think here's where I could probably spend the next hour talking about challenges, especially from a pharmaceutical seat, and as someone who's entrenched in the advocacy component. But a couple that I think probably really hit close to home for me are, one of the challenges are identifying individuals with diverse perspectives of lived experience. And at times, I don't know if others will agree, but I feel like we get in our own way looking for the perfect voice, which doesn't exist, right? Because everybody has a unique journey and all journeys are equally as important. Also, from my lens, another challenge that I see are navigating places and spaces where we're struggling with competing priorities. And so that always poses some challenges. And based on what you were just sharing, and again, thank you so much for being a champion on behalf of yourself and your loved ones and engaging in clinical research. But I'll be a little provocative with saying sometimes we're seeking to influence places and spaces that aren't quite ready to hear the authentic truths of the voices that need to be elevated. And here's where I really hope that when navigating in these spaces, that we will use that as a momentum to propel us forward and not as an excuse to shy away from challenging those conversations to really understand the why.
That's so great, Jenee. You're right. We do need to be cognizant of those that are not quite ready to hear our authentic and transparent selves, but you make a great point. So thank you so much for
Thank you.
sharing your perspective. Okay, Dr. Tann, for you.
Yeah.
Yes.
To Jenee's point, these are the things that I think about, and I'm hoping that individuals on this call will also think about. So I say, who is your audience? Who is listening to what you have to say? In fact, what are you saying? What is the content? Will you stay a while? Is it going to be a drop by or drop in? And I think the more prevalent question for me, the number one is, who are your community leaders? Are they passionate about brain health as you are? Will they come alongside you? Do they have credibility? These are important concerns as we think about the challenges that we face. And I think they're relevant questions. And I would like to pause it right there.
Great. Thank you so much, Dr. Tann. That's awesome. Yes. And if I can ask as a follow-up question, just we were looking at neurodegenerative disease specific to frontal temporal dementia. Is there anything you would like to say as relates to some of those challenges? Or I know you say we could probably be here all day, right?
No, actually, when we get to that third question, I
Okay.
have not forgotten about that.
Okay. Okay. All right. Awesome. No problem. Okay. And Rochelle, I'm going to repeat the question because I know I think someone just entered the room. What are the key challenges organizations or movements face when trying to elevate the voices of those directly impacted by our neurodegenerative disease?
Well, having been involved with this for as long as I have, I've talked to people one-on-one, friends, family, church members, classmates, whoever will hear me when I encounter, as well as I have attended AAIC, CTAD, being involved as much as I have. The challenge is, one of the challenges I see is the lack of relationships. When we have relationships, we tend to trust a little bit more because of the relationship we have. If we've seen it firsthand, then we have a little more content to work with, believe in, because the old adage, believe none of what you hear and half of what you see. The history, and I will go back because I do, and I have encountered it in my travels. I actually have a cousin who I was talking to about a clinical trial, and he was like, no way. I had somebody give me a drug against my will, so you can hang it up. We're not gonna even talk anymore. I'm like, okay, no problem. Still love you, cuz. We family. We've been family long before this conversation, and we will be afterwards. And so I take the cue when I get it. The history and predominantly in the African American community has not been good in research and clinical trials, and with the medical community even currently. And so it is a hindrance. It just takes time and patience and work of building that relationship in a community. With university hospitals, we've been doing a webinar series now for 4 years, and other activities in the communities we're working in, trying to build that relationship. It's kind of like stairs. You take one at a time, you know you made that one, but you won't find out how far you got until you get to the top and you look back. We've made minute progress, and I'm happy about that.
That's great. Thank you so much, Rochelle. You're right. And that's what we, as an IRI team, Inclusive Research Initiative team, we talk about how we need to meet people where they're at, right? We always have to think about that, right? We can't force people, even we're working on a clinical trial. Everybody's at a different stage, right? In that clinical trial process. So we need to meet people where they're at. So I love what you all are saying. This is such a great discussion, and just, it's good to hear, right? And for the audience to hear for different perspectives, right? And some of those challenges. So thank you so much. I appreciate that. Okay. So we have another question. Jenee, what strategies and solutions can be used to ensure that the voices of underrepresented and underserved communities are heard in advocacy efforts?
All right, I made sure I didn't have the same struggle coming off mute, but I wanted to kind of tag on before I answer that question, something that you just said, meeting people where they are. I lead a community health impact council, which is an amazing group of what we consider non-traditional champions because they're not necessarily connected in the healthcare perspective. And one of the things that I always remember is there is someone on the council who represents substance abuse and an unhoused community. And that person brings just incredible perspective. And they challenge me because I always love, like, we want to make sure we meet people where they are. And they said, you want to meet them where they are, but you don't want to leave them there. You want to take the journey with them. And sometimes in different communities, we hear that people will come and meet you and kind of, Dr. Tann, as you alluded, meet you, and then they walk away, or, they feel like they've done what they needed to do and then they've moved on to something else. So what does it look like to meet you and then to take the journey with you so that everybody continues to move forward? So thank you for sharing that. And that resonates with me. And I think about it all the time because that community champion is absolutely incredible in helping to shape and guide some of the thoughts that we've had from a Genentech perspective. But there are really 3 other kind of strategies that come to mind. And at the top of my list, it's identifying people who are already trusted in these vulnerable communities, who can help us understand what matters most, and that we can come alongside of. I think so many times we want to come in and we want to solve the problem, and nobody knows us. And just as you were sharing, Ms. Rochelle, like, people don't trust us, and rightfully so. So how do we do the work in alignment with others who are already in the trenches in a way that we can kind of amplify and magnify the work that's already being done, as opposed to wanting to reinvent the wheel, in a wheel that we're not attached to and that we don't have that historical context or trust in. Also, as I stated earlier, I think it's giving people a rightful seat at our tables. And that's very different than checking the box, but really inviting people to our tables and having them help us to shape our priorities, create culturally appropriate messaging, and really curating significant outcomes. And thirdly, I think, again, I like to kind of wiggle in between some spaces, but I feel like it's okay to respectively challenge one another. And I feel like we're not always there. That healthy tension is really good, as it's needed to ensure that our advocacy efforts aren't focused on that which is easy, but that which is going to be meaningful. So I think sometimes, and again, we've got the best of intentions, but we don't always do the work that we could do to really get to the root cause and figure out what's going to have the impact that we're looking for, in order to really ensure that the voices of community partners and others are heard and amplified, and all of the other things that they rightfully should be as our guiding principle and our guiding light.
I love that. Thank you, Jenee, for that reminder. And I love what that champion had said. Is that okay if I use, you can meet them where they're at, but then you have to continue, the journey with them. I love that. Yes, you're right. Thank you for that reminder. So Dr. Tann, and I was sorry to steal your thunder earlier with this third question, but I'm going to repeat it. What strategies and solutions can be used to ensure that the voices of underrepresented and underserved communities are heard in advocacy efforts?
Okay. I like how this is themed when we think about neurodegenerative diseases. I do. Because when I think about it, I think of inclusivity. So when I think about underrepresentation, I often think about what is unheard in terms of underrepresentation. And whom is underrepresented, unheard? And I would say to each and every one of us that I believe, in conjunction with Alzheimer's, I think frontal temporal, I think vascular, I certainly believe Lewy body, and oftentimes Parkinson's disease dementia is equally important and worthy of a discussion. So when I think about the word underrepresentation, we typically think about others, we think about people. But I want to raise the consciousness, if you will, and let's talk about the disease in and of itself, and that there is more than one. And frontal temporal, Lewy body, Parkinson's, and vascular are equally important to Alzheimer's. So when I think about underrepresentation, I think about that as well. When I think about underserved, it goes back to what we've been talking about all along. It goes back to trust. It goes back to relationships, because I believe when trust develop, it begets relationships. And we think about that in all facets of our relationships. We want trust with our significant others, in our relationship with our siblings, and certainly with our sons and daughters, and so on and so forth. Trust is quintessential. And again, trust begets relationships. And when you begin relationships, you begin to climb up that steep hill of accomplishment. And so that's how I think about underrepresentation and underserved communities. And I just want to quickly say that how important it is when I said awareness, people need to believe that they are seen. And I want to make it clear that I see you. And that's important.
Thank you so much, Dr. Tann. That's so great. You're right. Because we do focus on Alzheimer's disease, right? That's our large focus, but we don't tend to focus on the other, right, neurodegenerative diseases, as you mentioned. And thank you so much for bringing that to the forefront and for awareness. We really appreciate that. Thank you. I think we do have a few minutes for one question that I'm just going to throw to the three of you, whoever's willing and wants to answer. But my question is, what steps can be taken to empower participants to be advocates for themselves, rather than relying solely on outside advocacy groups to represent them? So whoever would like to take that?
I'm happy to jump in there from a pharma lens, but certainly hope that someone else will chime in as well. And I know I'm going to probably miss quite a bit on this, but I think the first step is education. I think it's teaching people the power of their voice, helping them understand how and where to share their stories, and creating opportunities for them to share their stories and what they've learned in settings that will allow them to make a difference. One of the things I'll say from my particular seat is it's been a privilege to learn from and really support some initiatives across patient-facing advocacy organizations who have created this type of programming and these types of trainings that are really focused on building a community of people to not only advocate for themselves, but on behalf of ones navigating similar journeys. And the excitement that you see when you're watching someone as they learn the power of their voice and what that means. I also think that everyone has a place in the advocacy journey. And to your point, while, there are patient-facing advocacy organizations that do an incredible job of representing thousands and millions of patients not patients, people. We are all people first, and we are navigating and living with different challenges. But I always like to rehumanize, because I know in a pharmaceutical space, we look at molecules and we think of, it's just a number or a subject. And I'm like, well, at the end of that is a person and a family. So I give space to that, and forgive me for that. But I feel like there's, in addition to what our advocates are providing to kind of provide all of the information that they're receiving from their constituents, I think that there's tons of room for people with lived experiences to be able to share their truths. And one of the things I'm firmly a believer in, and I've done it at Genentech and I've heard it come to fruition in others, is it's hard to ignore an issue when you can connect a specific person to it, because now that issue has a face and a name. And I don't know about you all, but when you see something in writing, you read the email. Oh, that's great. I heard these insights. Oh, they're great. And you move forward. But when you sit in a listening posture and you hear someone tell their journey, talk about their truth, share what the challenges are, the access issues, you can't ever unhear what you've heard. And so that typically resonates and starts to do some of the hard work that's needed in order to make that meaningful change and to uplift community in a different way.
That's fantastic. Thank you so much, Jenee. Because you're right. People need to feel empowered, but empower themselves, right? To be their own advocate and to not rely solely sometimes on advocacy groups. So thank you so much from your perspective working in pharma. Would anyone else like to? And if not, we can, go to Q&A, but Rochelle or Dr. Tann? Yep, Dr.
Let
Tann.
me add something to what Jenee just said. In addition, again, some E words. She's already said education. She said empowerment. But I like to include encouragement and also empathy, to feel with. I don't know that people want sympathy, but they sure love empathy. Feel with me. So I like education, empowerment, encouragement, and being empathetic. The E words.
I love that. We're going to remember those E words. Yes, that's something to write down, right? Especially when you're working in your role, right? With even study volunteers, study participants. I love those E words, right? We should have them close to us as we work in our daily roles. Rochelle, did you want to add anything or?
Yeah, just want to say thanks to Jenee and Dr. Tann, because I have used those E words to empower, to encourage, and be empathetic. And, I've watched a young lady that I've been on a journey with her once her mother was diagnosed and she became the caregiver. I have watched her blossom and become the advocate for herself and sharing that information with other family members, because it runs through her family as well. So thank you for the confirmation, Dr. Tann and Jenee. It warms my soul to know that, I'm on target, just as someone who has been a participant. And I'll close with this statement. Dr. Tann, you are so correct that the other dimensions are as important. Though Alzheimer's was my vehicle into this world, I met Lewy body. I met vascular. I've met and dear friends with Parkinson's. I have met traumatic brain injury. And so my advocacy, and the first question I ask and I state on, is that we need to know what we're working with first and foremost. Because while Alzheimer's is out there, there's 4 or 5 more that we know of that can be, and the treatment for each one is different. But the 3 E's will stand firm even to all 5. Thank you.
Thank you so much. Wow, I'm getting goosebumps here from everyone today, because that is just great. This is just such a great discussion, right, about amplifying the participant voice and what it takes to do that. So I thank you to my esteemed panelists for participating today and for your excellent responses to my questions. Thank you. I would like to use this time to open it up to our audience for question and answer. And I know I just want to be mindful. I just wanted to say Jenee is going to have to step off a little early, but just want to be mindful. And just if you have a question, please put it in the chat, or even if you want to, if you feel encouraged to go off mute and say your question, we'll give you a few minutes here. I think you all left everyone speechless. Everyone was so good. If we don't have any, and if it needs just a little bit of time for people to think about it, I do want to just open this up, just if you all, and I know, Jenee, I just want to be mindful, I know you have to jump off. My final question, I had a question too. It was a question I didn't know if we would be able to get to, but with different social media, right, and platforms that we have, my question was, what role do digital platforms and social media play in amplifying the voice of participants? And how can we leverage them without diluting the message or overwhelming the participants themselves? So you don't have to answer the full question, but any thoughts, Dr. Tann, Jenee, or Rochelle, about digital platforms and social media and amplifying the voices of participants?
There is a woman that I saw what she was doing in the greater Atlanta area, Efron Epps, I think her name is, and I could be wrong, but I was so encouraged when I saw what she did in the African American religious community. She pulled all the churches together. There was a huge information, education, enlightenment, and there was so resources. Everything was put into one place. And when you're in that environment, you get the you too, me too. And it kind of breaks the barrier for some, and it gives others something to think about and something to work with. And so that was very encouraging to me. I did reach out to her because I would like to bring that here to the greater Cleveland area, because the numbers are showing that we're one of the highest that are affected by this disease, by Alzheimer's, as well as the other dementias. And so bringing that here would help us to elevate our platform in Cleveland.
That's great. Thank you. I'll have to put you also in touch with Mia Chester, who's on our team. She actually supports and helps supports Dr. Efron efforts in the church. So thank you. And it's called Alter. Yeah. Yeah. Thank you. I didn't know if Dr. Tann or Jenee, I know you have to leave, or
Oh, happy to tech in. And that Rochelle, I think, is exactly what I was thinking when I looked at the question. It's the power of the community that also encourages community to take action. And I think part of it, as we were talking about before, it's the sharing of lived experience. It's making the personal connection so that it makes it easier to say, oh, I know something about that, or my story may be a little bit different, but they have some similarities. And so now I want to learn more. And I think it's a powerful tool for both education and promotion. I do say the one thing that, again, using that pharma lens kind of that we look at and we're a little cautious of is making sure that people are fully informed, because we do want to make sure that messaging is appropriate as it relates to maybe treatments or treatment options or therapies. But I think it's really important to get people's journeys, right? I think those are the things, Rochelle, when you talked about the conversation with your cousin, and me as well. My family's been touched with Alzheimer's, and I've gone through the caregiving space, and Dr. Tann knows. And I also support, in addition to Alzheimer's from a professional standpoint, I support Parkinson's, and my godmother is navigating her journey in some of her final stages with Parkinson's. So I understand what it means. And I think it's, again, that personal connection and that touch that drives mobility. It drives action, it drives education, and it drives community. And so I think from a pharma standpoint, we love technology when we think about campaigns and all the things, because you can get messaging out. But when you think about amplifying voices and giving that community and personal connection, that's the part, again, you can't unhear something you've heard that helps you to understand your journey. And it gives you a point of reference. And it almost is kind of like you're sitting in your kitchen, right? You're having family conversation, you've heard something, and it sometimes resonates and connects differently.
Is it okay if I drop in on this?
Yeah, go right ahead, Dr. Tann. Thank you, Jenee.
When I thought about the question you just posed, these platforms are powerful mediums, no doubt about it, but they're never to replace the true authenticity of individuals. And also, it's important to me, and I've said this earlier, how the theme "I see you" is so important. And so when we think about all of these platforms, it is essential that they represent the population they're intended for. I was on a call last night, and when I saw the graphic, it looked nothing like me. In fact, I saw no different hues in the graphic. And so I think it's just important that we just never lose sight about the importance of social media, for sure. And we should use these things that avail us. But at the same time, we should also be very conscientious about whom we're trying to reach and through what medium.
That's great, Dr. Tann. You're right. And thank you for that reminder. We have to be intentional, right? And I know that's what John had shared earlier. It's all, being intentional and mindful of the community you're serving and you're trying to reach out to. So thank you so much. This has been a great discussion. I'm so excited about it. And I wanted to see if I know we only have a few minutes. Just wanted to see if there were any other questions. Thank you so much, Jenee. We really appreciate you joining the panel. Thank you. Any question from the audience? I know, and if not, I will leave the time for you all to get ready to attend the next panel, because we have back-to-back panels, but just give one more minute. Anyone else have any question for Dr. Tann or Ms. Rochelle Long?
Just for the record, I just wanted to say thank you, because this was another opportunity for me to get my story out with a face. Because this is real. It's very real. It's very real to me and my family. I've been able to hold it together to this point. But it is a passion. And like I said, and to what Dr. Tann was saying, never lose that personal touch, that one-on-one, because it's real one-on-one on social media, on the platforms. It's informative. But, I would love to sit down with Dr. Epps one-on-one. And I look to sit down in our women's group and we talk one-on-one. That has a stronger you to me to value than what we see on social platforms. Social platforms are great. They provide you with a key or a tool to open up a door to somewhere else.
Thank you so much. Thank you. And I just say thank you for being a trailblazer and our Citizen Scientist Award Elevated Honoree. You have done tremendous work in this space. So thank you so much.
Thank you.
Yeah, no problem. And I guess, Dr. Tann, any last minute remarks before we just say goodbye?
Yeah. Thank you for the opportunity. I'm like Rochelle, I'm given an opportunity to be heard and to be seen. I see you is very important. So thank you for this opportunity, and everybody on the call. I sure hope that we've given you some takeaways that you will, if nothing else, just ponder.
And thank you, Dr. Tann, and all the amazing work you have done for your community. I had the pleasure of visiting her community, and it was just an awesome experience. And I just thank you for all the work you do at Reminiscent. So thank you so much for being on the panel today. And it's just been tremendous. And for those that missed it, it is going to be recorded. So we'll make sure we share it with the others who are attending the other panels. But thank you again for attending today's panel, and we will see you in the next one. Thank you so much. All right. Bye-bye.